morning, sir. Can I come in? Thank you. How are you this morning? Good. That's good to hear. My name is Danny. I'm gonna be performing some hygiene for your tracheostomy, removing any excess mucus that has formed. Is that okay with you? Awesome. Thank you. Can you just verify your name for me, please? Danny Martinez. Good. And the date of birth? April 28, 1996. Good. Okay, I have assembled my equipment in the side table. I'm gonna go ahead and perform hand hygiene, provide privacy, and I'm gonna go ahead and assess lung sounds. Sir, I'm gonna go ahead and assess your lungs, okay? Take a deep breath for me. Good. Again. 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 Good. Now, can you just lean forward so I can listen to the back? Take a deep breath. Good. Good. Okay, good. Okay, so your lungs sound clear, non-labored. Oxygen saturation is above 90%, so I'm okay to proceed. Okay. Are you in any pain right now? Good. That's very good to hear. At this point, I would wash my hands, put on gloves. I'm gonna assess for any secretions. Okay, I don't see any. Are you ready to start? Good, good, good. It shouldn't be painful, but if at any point you feel like you are out of breath, you're having difficulty breathing, please let me know by doing a stop sign. Just raise your hand and I'll go ahead and stop, okay, and provide some oxygen. Okay, so the patient is conscious. So at this point, I would raise him to a high phallus position. If the patient was unconscious, I will put him to the side. I will raise the bed to a working height. And yeah, I'm gonna go ahead and start by putting my face shield, put on hair protection and clean gloves. So suction has been performed already, so it is not necessary at this point. So with clean gloves, I would remove the old dressing and assess for any signs of infection, blood, pus, any odors, and I don't see anything. I would discard this. I would look under the faceplate to see again any signs of infection. I don't see any redness, any pus, any noticeable odors. Okay, again I would remove gloves and perform hygiene. I have already brought my supplies and I'm gonna go ahead and open them. I would put my store gloves to the side. And I'm gonna go ahead and open drape shiny side down, and I'm just being very careful not to touch anything outside the 1-inch border, which is my sterile field. Again, being very careful not to touch anything inside my sterile field. I would pour out the contents. Good. Now a trach, nothing above my waist level. How are you doing, sir? No difficulty breathing? Okay, I have replaced my oxygen. I'm gonna go ahead and put on clean gloves. And oxygen saturation is still 99%, which is very good. Sir, ready to start? I'm gonna stabilize the faceplate. I'm gonna remove the inner cannula. And place it in my container for the hydrogen peroxide. Okay. I will replace oxygen as well. Discard my gloves, perform hand hygiene again. And I'm ready to put on my sterile gloves. The outside I can touch. And then I'm not going to touch anything outside the 1-inch border. Okay, and I'm ready to start. I'm touching the cuff only. Nothing inside. Okay. Okay, good. Now I'm ready to start. Now I'm completely sterile. How are you doing, sir? I'm gonna go ahead and empty the contents of the oxygen peroxide into my container. And I would discard this. And I'm gonna open the contents of the normal saline. I will discard this. Okay. Do you have any difficulty breathing, sir? Good. I would gonna dip my brush and go ahead and clean it inside. Removing any excess secretions that have formed inside and outside of the inner cannula. I'm gonna go ahead and dip the inner cannula in the normal saline. I'm gonna remove the excess fluid. I'm gonna place the inner cannula in one of the sterile gauzes to dry. You gotta be very careful not to contaminate my sterile field, and I'm gonna go ahead and pat dry the inner cannula to remove any excess fluid. I'm gonna assess the inner cannula with my non-dominant hand to see if there has any excess mucus formed. I don't see any. Otherwise, I would have suction using Searle's technique. Okay, so my inner cannula has been dried, and I'm gonna go ahead and put it in. Again, using my hand. I'm no longer sterile though. Okay. Are you doing okay, sir? I'm gonna replace the oxygen source. And I'm gonna clean it under the faceplate to remove any secretions using normal saline. I'm gonna discard this because I already cleaned one side. Again, I'm gonna clean the other side and discard. I would use one of my gauzes. To clean under the faceplate. Okay. And I would dump this. Sir, how are you doing? Any difficulty breathing? Good. Okay, so we're ready to put in the fenestrated dressing. At this point, I would call my second nurse to help me stabilize the faceplate while I undo the ties to prevent anything from dislodging. Okay. So I have my second nurse and I instruct her to stabilize the faceplate while I undo the ties and I replace the ties. Okay. Okay. Are you ready? Thank you for coming. I am gonna go ahead and slide this under the faceplate. Okay. Any pain, sir? Good. Okay. So I'm gonna go ahead and undo the tie. You hold the faceplate, okay, in place. Okay, good. Okay, I will discard this. The other nurse would help me place the ties. And I will stabilize the faceplate. Okay, sir. Sorry about this. Are you doing okay? Good. I would do a quick release knot in case of an emergency. Okay, good. I would replace the oxygen source. How are you doing, sir? Any difficulty breathing? Okay, oxygen saturation is still 99%. I'm gonna go ahead and listen to your lungs once again, just to see if you are doing okay. Take a deep breath for me. Good. Again. Again. Okay, good. Now can you lean forward for me? Okay, again. Deep breath. Okay, so patient respiratory status is within normal limits, non-labored, regular, and oxygen saturation is above 9%, so the patient is doing good. Did you experience any pain during the process? No? You don't want anything for pain? Okay, good. If you need anything, please let me know. I'm gonna go ahead and remove my supplies from the table. Make sure the collar is within reach of the patient. Return the bed to the lowest height. And remove PPE. Wash my hands. And I think that's it. Thank you, sir. If you need anything, please let me know.